This question deals with antibodies detected in a serum. So we're talking about antibodies. Okay. Antibodies detected in a serum of a 34-year-old Caucasian male are found to react with alpha 3 chain of collagen type 4. Okay. That's your answer right there. This should be enough to give you the answer. The patient is most likely to have which of the following clinical findings? Antibody against collagen type 4 is glomerular basement membrane. This should be you should have it memorized by now. The target for antibodies is for the glomerular basement membrane is specifically alpha 3 chain, which later on progresses to RPGN, forms crescents. Crescents are made up of fibrin, parietal cells, monocytes, macrophages, and plasma proteins such as IgG and C3b. Okay, so but that is, good pasture syndrome. Let's talk quickly about some of the options here. Option A, joint pain and cardiac murmur. That is for rheumatic heart disease. And in rheumatic heart disease, what happens? Antibodies against M proteins of the strep cross-react with the glycoproteins of the heart and the joints, and then they deposit in those joints and in the heart. That's a rheumatic heart disease. The thing is, rheumatic heart disease is very similar in pathology to strep, okay? Because they are both autoimmune. The only difference is, actually there's two differences. The first difference is that they're two different serotypes of strep. So they're not the same kind of strep. They're same family, two different serotypes. That's one difference. The other difference is post-streptococcal glomerulonephritis is circulating. The immune complex is circulating. They happen to deposit in the kidney. But rheumatic heart disease, those immune complex deposition is inside too. So it happens in the heart and in the joints. I'm sure you know this, but I'm sure you have not thought about this in this particular angle. The next one, nasal ulcer and hematuria. Nasal ulcer and hematuria. That should, whenever we have hematuria, so urine problem, blood in urine, and nasal ulcer, we should think of Wagner. Be careful. Don't think that this is a good pasture. There's a slight difference. Good pasture deals with lower respiratory tract. Wagner deals with lower and upper respiratory tract. So the nasal ulcer is only going to be seen in Wagner but not in good pasture. Also, Wagner is also called pauci-immune, and pauci-immune means that it does not have antibodies against glomerular basement membrane. Okay, so Wagner is pauci-immune. Something I just wanted to throw out there. It does not have anti-glomerular basement membrane antibodies. So that's choice C. Sorry, choice B. Moving on to choice C. Choice C, malar rash and pleural effusion. That's typical for SLE. What do we know about SLE and what do we know about antibodies? Since this question dealt with antibodies, let's talk about antibodies. What's a sensitive antibody for SLE? ANA, right? But is it sensitive? Is it specific for SLE? Absolutely not. What is specific for SLE? Anti-Smith antibody, anti-double-stranded DNA antibody, right? So that's our SLE. And what about choice D? Choice D, we have hemoptysis and oliguria. Hemoptysis. Hemoptysis is problem of the lung, oliguria problem of the kidney, right? But hemoptysis is problem of the lower lung, not the upper lung. So in this case, choice D is our desired answer. That is our good pasture. What about choice E? Dysphagia and sclerodactyly. Dysphagia is due to esophagitis. Sclerodactyly and esophagitis, both of this combined gives us CREST syndrome, C-R-E-S-T, right? Calcinosis, esophageal dysmotility. R is going to be for Raynaud's, S is going to be for sclerodactyly, and T is going to be for telangiectasia. So esophageal dysmotility is going to give us dysphagia. So this is going to be CREST syndrome. And the antibody against CREST syndrome is going to be anti-centromere antibody.